Have you ever pictured a robot, like tucking you into bed in a hospital? Sounds a bit sci-fi, right? But the buzz around AI in healthcare is absolutely real. Today, we're taking a serious look at a question many of you have probably pondered. Could artificial intelligence actually step into the shoes of a nurse?
It's a question that gets right to the heart of care, doesn't it? We're seeing AI evolve at, well, an incredible pace, and its potential impact on how we receive medical attention is huge. So in this deep dive, we're not just skimming headlines. We're really digging into the data, the studies, the expert opinions to, understand if a future with fewer human nurses is actually on the horizon.
Exactly. Because you're the kind of person who wants the real story, right? You want to know what AI is truly capable of in a healthcare setting, what the limitations are, and what the people in the know are actually saying. We've gathered a whole range of information, from detailed research reports to on-the-ground examples of AI in action. Our mission today is pretty simple: to give you a clear, insightful understanding of whether AI could genuinely replace nurses, cutting through the hype and getting to the reality.
And what our sources make clear pretty much from the start is that this isn't a black and white issue. It's complex. The healthcare landscape is being reshaped by AI in some, well, fascinating ways. So maybe let's start with the basics. When we talk about AI in healthcare, what does that actually mean in practice?
Okay, yeah, let's unpack this. Because when someone says AI in healthcare, my mind races to all sorts of possibilities. We're not just talking about super advanced calculators, are we? What's the underlying principle here?
Well, at its core, AI in healthcare involves using computer systems to process vast amounts of information and then use that data to make informed decisions or even automate certain actions. Think of these systems as learning from huge data sets, a process called machine learning, allowing them to identify patterns and make predictions in ways traditional software simply can't. It's this ability to learn and adapt that really sets AI apart.
Learning as it goes.
Mm-hmm.
Okay, that sounds like it has the potential to be incredibly powerful. So where are we actually seeing this in hospitals and clinics today? Can you give us some real-world examples of AI in action?
Absolutely. One significant area, and this is highlighted in several reports, is clinical decision support systems, or CDSS. Imagine an AI assistant that can analyze a patient's entire medical history, their electronic health records, the latest research findings, even relevant medical literature, all to provide nurses with evidence-based recommendations. The real takeaway here is that AI is poised to move beyond simple record-keeping to become an active partner in clinical decision-making. It's essentially putting a vast library of medical knowledge at a nurse's fingertips, but, and this is crucial, it's an aid, not a replacement for their own judgment.
Right. That sounds like it could be a total game changer for nurses dealing with so much complex information all the time. So it could flag potential risks or suggest the most effective treatment based on a massive amount of data.
Yeah, precisely. The sources suggest this can lead to more accurate diagnoses, better treatment plans, and crucially, the ability to predict when a patient's condition might be about to take a turn for the worse. Imagine getting an early warning that allows for timely intervention. That's a powerful capability. These systems can even help optimize medication management, double-checking dosages and flagging potential interactions.
Wow. Okay. That's going way beyond just digital charts. What are some other ways AI is showing up in healthcare right now?
Another really impactful area is patient monitoring and predictive analytics. We're seeing AI integrated into wearable devices and other systems that continuously track vital signs and other physiological data. But these aren't just passive monitors. They use AI to spot subtle changes that might indicate a developing problem, sending real-time alerts to nurses. And building on that idea of AI analyzing patient data, another fascinating application is in long-term monitoring and predicting potential problems before they become critical. This can help anticipate resource needs and kind of get ahead of potential crises.
So it's not just reacting to what's happening, it's trying to see around the corner. That could really help with proactive care, couldn't it? Now, what about some of the more day-to-day tasks that nurses handle, the administrative side of things? That takes up so much time.
Oh, absolutely. AI is making inroads into the automation of administrative tasks. Think about all the scheduling, data entry, and documentation that consumes a nurse's valuable time. AI algorithms are being developed to handle these routine tasks, prioritize patient needs based on data, and streamline communication between different members of the healthcare team. We're even seeing AI-powered chatbots and virtual assistants helping with these functions. And something that sounds particularly useful is AI voice transcription software for documentation. Imagine the hours that could save.
No more mountains of paperwork. That's a thought that would probably bring a smile to many nurses' faces. And I've heard whispers about virtual assistants actually interacting with patients. Is that really happening? Good.
Yes, the sources do discuss virtual nursing assistants. These AI-powered tools can provide patients with information about their medications, explain self-care instructions, and answer frequently asked questions. Some can even tailor this information to individual needs and offer support in multiple languages, which could significantly improve patient understanding and adherence to care plans.
That could be incredibly helpful for patients who might feel hesitant to constantly bother a busy nurse with basic questions. Okay, now let's talk about those robots I initially pictured. Are we seeing actual physical robots on hospital floors?
We are, yeah, but it's important to understand their current role. While the idea of a fully autonomous robot nurse is still largely in the realm of science fiction, robotics in nursing is a developing field. We're seeing transfer robots to help move patients safely, mobility robots to assist with walking and personal hygiene, monitoring robots equipped with cameras and sensors, and even socially assistive robots being explored for companionship, particularly in elder care. You also have telerobots for remote care in specialized situations. You mentioned different types of robots, right? So like a socially assistive robot might engage with patients through conversation, offer reminders for meds or activities, or even lead them in simple exercises. It's about providing a level of interaction and support, not complex medical care.
Okay, so they're more like high-tech helpers rather than replacements for the human touch.
Exactly. The current emphasis is absolutely on how these robots can support nurses in their daily tasks. And interestingly, one of our sources mentioned research on the use of robots in nursing homes, and it actually found a link between their use and higher employee retention and better patient care. This suggests that these technologies, when implemented thoughtfully, can actually contribute to a more positive healthcare environment.
Huh. That's a really interesting point. The technology could actually improve job satisfaction for nurses. So, looking at all these current applications, from AI analyzing data to physical robots assisting with tasks, which of these do you think has the most immediate potential to really change a nurse's daily routine?
That's a good question. I'd say the combination of sophisticated clinical decision support systems and the automation of those routine administrative tasks likely holds the most immediate potential for a significant impact. CDSS can directly empower nurses with crucial information and insights right at the point of care, while automation can free up a substantial amount of their time, allowing them to focus on direct patient interaction and the more complex aspects of care that require their unique skills.
Okay, so AI is clearly making its presence known in healthcare, no doubt about it. But let's switch gears a bit and look at why many believe that nursing is actually a profession that's relatively safe from being completely replaced by AI. What are those uniquely human qualities that are just so difficult for a machine to replicate?
Right. This is where we delve into the very essence of nursing, isn't it? Our sources consistently highlight human compassion and empathy as a fundamental aspect of nursing that AI cannot truly replicate. Nursing isn't just about performing procedures, it's about connecting with another human being on an emotional level, offering comfort, understanding, and genuine support, especially during times of vulnerability. That human touch, a reassuring presence, these are vital for creating a therapeutic environment and building the crucial trust between a nurse and a patient. AI, well, in its current form, simply cannot provide that authentic human connection.
That makes perfect sense. You can program a robot to say comforting words, sure, but it lacks the genuine understanding and feeling behind those words. What else distinguishes human nurses?
Ethical reasoning is another critical area. Nurses are constantly navigating situations that require complex moral judgments, advocating for their patients' rights, and considering individual values and cultural nuances. These aren't scenarios that can be easily reduced to algorithms. Decisions around end-of-life care, informed consent, or navigating conflicting family wishes involve a level of human wisdom and ethical consideration that goes far beyond the capabilities of current AI.
Absolutely. It's about understanding the whole human context and individual circumstances, not just following a pre-programmed set of rules.
And then consider the dynamic and often unpredictable nature of healthcare settings. This demands adaptability and flexibility, qualities that human nurses possess in abundance. They're constantly making real-time adjustments to care plans based on a patient's immediate responses and subtle cues in their environment, often in situations they haven't encountered before. AI, which really relies on its training data, might struggle to handle novel or unexpected situations effectively. It's like trying to follow a map when the terrain suddenly shifts underneath you.
Yeah, it's like trying to navigate a maze where the walls are constantly moving. A pre-programmed route just won't cut it.
Exactly. Then there's patient education and communication. A huge part of a nurse's role involves explaining complex medical information in a way that patients and their families can understand, providing ongoing emotional support and building trust. This requires not just clear articulation, but also empathy, active listening, and the ability to tailor communication to each individual's unique needs and understanding areas where AI currently struggles to connect on a truly human level. I mean, I can imagine trying to have a heart-to-heart about a difficult diagnosis with a chatbot. It would likely feel very impersonal.
Oh, definitely. I can imagine trying to get emotional support from a chatbot during a difficult diagnosis. It just wouldn't feel the same, would it? It lacks that warmth.
And finally, nurses adopt a holistic approach to care. They view the patient as a whole person with interconnected physical, emotional, social, and even spiritual needs, not just a collection of symptoms or data points. That ability to connect with someone on a personal level and understand their broader life context is fundamental to patient-centered care, and something that data-focused AI cannot fully replicate. So while AI can be an incredibly efficient tool for processing information, it often misses the broader human story.
So it's almost like AI can be an incredibly powerful tool for processing data, but it misses the entire human story behind the numbers.
That's a very insightful way to put it, yeah. It can analyze data efficiently, but it lacks the human intuition, the ability to read between the lines, and to respond to unspoken needs.
Okay, so while AI has some truly impressive capabilities, it sounds like there are some pretty significant roadblocks when it comes to the idea of it completely replacing nurses. Let's delve a bit deeper into those limitations. What are some of the specific challenges that AI faces in the healthcare environment?
Well, we've already touched on the fundamental lack of genuine empathy, and our sources consistently underscore this. AI can be programmed to generate sympathetic sounding responses, sure, but it doesn't possess the capacity for authentic emotional understanding or connection, which is so vital in the nurse-patient relationship.
Right. It's about more than just feeling heard. It's about feeling genuinely cared for, isn't it?
Precisely. Then there's the crucial aspect of critical thinking and decision-making in complex and ambiguous situations. While AI excels at analyzing data based on its training, applying nuanced judgment that goes beyond its programming, especially in unique or unexpected medical events, remains a significant hurdle. The sources also raise concerns about something called automation bias, basically, where healthcare professionals might become overly reliant on AI's recommendations without exercising their own critical judgment, potentially overlooking important clinical cues.
So we still need that human oversight to catch potential blind spots in the AI's analysis, or just to double-check things.
Absolutely. We need that layer of human judgment. Another challenge is algorithmic bias. AI systems are trained on data, and if that data reflects existing societal biases regarding race, gender, socioeconomic status, whatever the AI can inadvertently perpetuate or even amplify those biases in its recommendations, potentially leading to unequal treatment outcomes, that's a huge ethical concern.
That's a really serious point. Biased data leading to biased care. What else?
There's also the issue of transparency, sometimes called the black box problem. For some complex AI models, it can be difficult to understand how they arrived at a particular decision or recommendation. This lack of clarity raises concerns about trust and accountability, especially if an AI makes an error. Who's responsible? How do we fix it if we don't know how it works?
Yeah, that accountability piece is huge. If something goes wrong, who takes the fall? The AI, the developer, the nurse who followed the recommendation.
Exactly. And finally, as we mentioned briefly, AI currently faces limitations in understanding the nuances of human communication and providing truly culturally competent care. Effective communication in healthcare involves more than just exchanging information. It requires empathy, understanding diverse communication styles, sensitivity to different cultural backgrounds, all areas where AI has significant room for growth.
It really sounds like while AI can process information with incredible speed and efficiency, it still has a considerable journey ahead in truly understanding the intricacies of human beings and the often messy reality of healthcare. Can you think of an instance, maybe something from the sources, where a human nurse's unique skills or understanding went above and beyond what an AI could potentially do?
Well, there are countless anecdotal examples, but one theme that comes up is nurses noticing subtle, nonverbal cues that wouldn't typically be captured by standard monitoring or data points, like A slight change in a patient's posture, a flicker of fear in their eyes, or a hesitation in their voice. A seasoned nurse can pick up on these things, sense that something isn't quite right even when the objective data looks okay, and investigate further. That kind of intuition, honed over years of human interaction, is incredibly difficult, maybe impossible, to codify into an algorithm.
That's a powerful example of the irreplaceable value of human clinical judgment and just human connection. Okay, so with all these capabilities and limitations in mind, what are the general expectations and predictions from experts regarding the future role of nurses? Are we heading towards a scenario of widespread replacement, or is something else more likely?
The overwhelming consensus among the experts we looked at is that we're on the cusp of a significant transformation within the nursing profession, rather than, a wholesale replacement by AI. The prevailing view is that AI will become an increasingly powerful toolkit to augment and enhance the work that nurses do.
Augment. So it's more about working alongside AI than being replaced by it.
Precisely. Many experts believe that AI will take on the burden of more routine tasks and administrative duties, the things that often contribute to burnout among nurses. By automating things like documentation, scheduling, and maybe even some aspects of basic monitoring, AI can free up nurses to dedicate more of their time and energy to the complex, human-centered aspects of patient care that truly require their unique skills and compassion. This could potentially lead to greater job satisfaction and a renewed focus on the core values of nursing.
That sounds like a really positive potential outcome, using technology to empower nurses to do what they do best, the human stuff.
And the experts also emphasize that nurses themselves will need to play a vital role in the development and implementation of these AI technologies. Their firsthand experience with patient needs and the realities of clinical workflows is absolutely crucial in ensuring that these tools are not only effective, but also seamlessly integrated into practice and used ethically. It's going to require a collaborative effort between nurses, AI developers, and other healthcare professionals to ensure these technologies truly serve the needs of both patients and caregivers.
So nurses need to be actively involved in shaping how these AI tools are actually used in their profession. They can't just have it imposed on them.
Absolutely. Looking ahead, there's also a growing recognition of the need for AI literacy among nurses. While they won't necessarily need to become AI programmers, they will need to develop a solid understanding of how these tools function, how to interpret the data they provide, and how to integrate them effectively and critically into their clinical decision-making processes. Nursing education programs will likely need to adapt to prepare future nurses for this evolving technological landscape.
Right. It's not just about knowing how to take a blood pressure anymore. It's also about understanding the information AI is providing and knowing its limitations.
Exactly. Some experts even foresee the emergence of new specialized roles within nursing, perhaps AI nurse consultants who focus on the integration and management of AI systems within healthcare settings, or maybe telehealth specialists who leverage AI to deliver remote patient care more effectively. The ability of AI to analyze vast amounts of patient data and facilitate more personalized and precision nursing approaches is also seen as a significant area of future development.
So we might see new specializations within nursing that are focused specifically on working with AI. That's interesting.
Precisely. It's a dynamic and evolving field, and the role of the nurse is likely to evolve right alongside it. But it's worth noting, not everyone is purely optimistic. Some sources highlight concerns, particularly from nurses themselves and unions, about potential job displacement down the line or the risk of de-skilling if nurses become too reliant on AI, eroding their own clinical judgment. There's also that persistent concern about technology further dehumanizing the care experience. And surveys show nurses have mixed feelings, some excitement, but also anxiety.
Right. So it's not all rosy. There are definitely potential downsides and anxieties to address as this technology rolls out, which brings us to the ethics of it all.
Definitely. The ethical considerations are massive. We touched on algorithmic bias, but there's also patient privacy and data security. AI systems often require access to vast amounts of sensitive patient health information, raising significant risks if that data isn't properly protected from breaches or misuse.
Huge concern. What else on the ethical front?
Transparency and accountability, like we discussed, understanding how AI decisions are made and establishing clear lines of responsibility when errors occur. Then there's patient autonomy and informed consent. Patients need to be aware of when and how AI is being used in their care and have the ability to consent to or refuse its use. And fundamentally, there's the ongoing ethical debate about the potential impact on the nurse-patient relationship, ensuring technology enhances rather than diminishes human connection and compassionate care.
Okay, so pulling all these threads together, the capabilities, the limitations, the expert opinions, the ethical minefield, how do the different perspectives stack up on the core question? AI replacing nurses.
You essentially have two main camps, though most experts lean towards one side. On one hand, you have the viewpoint emphasizing AI's potential for automation, particularly for tasks currently done by nurses. Some argue that advancements could eventually lead to AI taking over more complex roles, driven by potential cost savings and efficiency gains. This perspective often fuels the job displacement concerns we mentioned.
The robots are coming for our jobs argument, basically.
Kind of, yeah. But the much more dominant perspective, supported by the bulk of our sources, argues that complete replacement is highly unlikely. This view emphasizes those irreplaceable human aspects: empathy, critical thinking in novel situations, ethical judgment, nuanced communication. It positions AI firmly as a tool for augmentation, helping nurses work more effectively, not replacing them. They also point to the practical limitations of AI, the risks like automation bias and algorithmic bias, and frankly, public discomfort surveys show many people aren't comfortable with AI making major healthcare decisions for them.
Right, that trust factor is huge. People trust people, especially when they're vulnerable.
Exactly. So the prevailing expert view really leans towards augmentation and transformation, not replacement.
Okay, so to wrap up our deep dive into this really fascinating topic, what are the absolute key takeaways regarding the potential for AI to replace nurses?
Well, I think the central takeaway is that while AI is poised to revolutionize many aspects of healthcare and provide nurses with incredibly valuable support tools, the complete replacement of human nurses is highly improbable, at least in the foreseeable future. Those uniquely human elements that define nursing: empathy, ethical judgment, adaptability, effective communication, and that holistic view of the patient remain firmly beyond the current and likely near-term capabilities of artificial intelligence.
So the future looks more like a partnership.
Yes, precisely. The future likely lies not in a replacement, but in a powerful and evolving collaboration between human nurses and AI technologies, ultimately aimed at enhancing the quality, efficiency, and maybe even the humanity of patient care if implemented thoughtfully.
And by digging into all these different sources today, hopefully you listening now have a much deeper and more nuanced understanding of this complex issue, moving far beyond just the simple headlines and into the real possibilities and, importantly, the limitations of AI in the context of nursing.
It definitely gives you a lot to consider, doesn't it?
It really does. So for you listening, as AI becomes increasingly integrated into the fabric of healthcare, here's a thought to maybe mull over. How do you envision the ideal partnership between human nurses and artificial intelligence? What are the key principles, maybe the ethical guardrails, that should guide the development and implementation of AI in healthcare to ensure that it truly serves to enhance rather than detract from the compassionate and effective care that nurses provide? It's a conversation that's really got a beginning, and everyone's perspective, including patients, is a vital part of it. You might find it valuable to explore some of the specific sources we touched on today, particularly maybe those examining the evolving roles within nursing or the ethical frameworks being proposed. It's a truly fascinating and incredibly important area to keep an eye on.